going to come next.
So how many, I'm going to have to ask, how many people, like, in the last 2 years, with the lung stuff, you know, they say it's pneumonia, but it's actually a pulmonary edema.
Oh, okay. Yeah, because I have a lot of patients that had pneumonia and they said that it, but they use pneumonia exactly. They didn't use
right.
with the term that you're using.
Yeah. So what happens to a person? They cough, but do they continue to take it?
You want to do a whole treatment. Yeah, it's like the eye drops. It'll start to rebuild it and everything. And then once you're done, you fix it. You can do it lightly if you like, or you don't have to use it anymore with the lungs. I mean, the eye drop's different. You do want to here and there, but with the lungs, if you want, if you feel something, you can use it again. But you do want to do a whole treatment of the lungs before you can be like, I'm done. Yeah.
Yeah. Can you take the eye drops and the lung treatment at the same time?
Yeah. You can do them all. So a lot of people like to do is, since they have really bad allergies, a lot of people like to use the eye drops with the nasal spray. Because I'm going to tell you guys about the nasal spray next. So, because the nasal spray goes to a different part, your mucous membrane, but your eyes, your nose, and your ears are all connected. So when you use it all together, of course you feel amazing because you're hitting all angles, So so the nasal spray, that's the other thing I was telling you. So anybody with allergies, instantly, because we a lot of people have where it closes up right here, and you can't get past that part unless you go get surgery. They have to go and open it up for you, or they'll use those other nasal sprays at the store that get you addicted to them, or you'll have to get surgery because they closed up your nose also. So that's what I do. A lot of people with this closed. So what you do with the nasal, instantly it penetrates through that layer there's nothing that can get through it. And I'm talking about within a minute. Right when you use it, it's going to open it up. Your nostrils flare open because that's what you're supposed to do when you're breathing well. You're supposed to have your nostrils are supposed to be open. We're all tight because of the air quality and everything. So instantly when you use it nasal, boom. And then we have testimonials on there. It also helps with seizures because there's a testimonial on there. We were eating in LA after I won an award. We went to go eat tacos, and we were there, and for some reason something kept us there longer. Like, we usually eat and we're tired, let's get out of here. We ate and we stayed talking for a while, and literally a 12-year-old girl literally lands almost on my lap having a full-on seizure. And I always carry this with me, and I always carry my nasal spray everywhere I go because I just never know who I'm going to help. Like, who are you going to bless today if you see somebody that needs it? So I had it on me, and I just said, can I use this on your daughter? And she's like, it was in the heat of the moment, yes. Did the nasal spray, and then within 20 seconds, she stopped. And when she stopped, then I put the eye drops on her. See, I like to use the nasal spray for seizures because it's too hard to get a drop on a person that's shaking like that. You're gonna everywhere, right? Yeah. So the nasal is the best. You can squirt it in there, and then you can add the drops later. And within 20 seconds, she was fine. And then I'll show you guys that too. It's on Instagram, the testimonial. We didn't get the video, but we got pictures because it was he was there, and I was mad at him for a little while. I was like, why didn't you get that? But he didn't even know what was going on,
Well, everybody's freaking out.
Well, yeah, it was at the restaurant.
Everybody's flipping out.
Oh my goodness.
So that's one good thing. So not just the breathing part, it does so many things that we just scratch the surface on what it can do. Like, we're just finding out every day a new testimonial. I don't say the testimonials. I let the patients say. I let them speak through what they feel through the medicine. And I got to be careful too, because what it's doing, we got to watch out on with with how it's working so well. We got to watch our words with the government. You got so this is being ran as a dietary supplement right now to protect myself. But then we got some investors coming in that want to do FDA trials for it because we have like we can do 6 different variant drops for like pink eye, glaucoma, cataracts. So we can pretty much take over all the drops that's out there because none of those drops work well. I mean, even when you get pink eye, you get the drops from the doctor. It takes too long to kill the pink eye, even if it does kill it. Yeah. With my drops, within 2 days, any infection, staph infection, pink eye, we have been doing it with patients. I mean, any infection. I mean, we got one that's really cool too. She's a Hollywood makeup artist. She had lash extensions, and she got a really bad infection, and she got antibiotics from the doctor. Wouldn't work. She did these, within 2 days gone. And then her dog, same thing. Her dog scratched her eye, because now dog, had a scratch. The antibiotics wouldn't work. well, she said not even 2 days. It noticed like it was just back to normal. Like it was so quick that she didn't even notice it. We got her testimonial too. So that's another thing. Eye infection. I mean, you name it. I mean, but if you don't have eye problems, I mean, it's good just to cleanse your eyes and get everything out, because sometimes everyone has eye stuff that we don't even know about.
Yeah.
You know, we don't even know we have the problem. So it's
Yeah.
like,
Maintenance.
Mhm.
What viruses go into the body through the eyes?
exactly. Our eyes are like sponges, so they absorb everything.
Yeah.
So what the eye drops
Maybe
do,
keep
when
our
you do the
eyes
drops, it kind of like, it puts like a protectant layer over your eye, or, you know, it doesn't allow stuff to go through, because like exactly what she said, this is the key to our soul, you know, the eyes, so you gotta protect them, and that's another reason why I started these, because when I grew up, my family was dying, they were going blind of diabetes. It's really bad in our family, and they would go blind, and then they'll get chopped their foot, their leg, and then there's nothing else to chop no more, then they die because the infection is so bad.
Right.
So one of my favorite aunts, I had seen it happen to her when I was growing up, and it really affected me, and I was like, you know what, there has to be something out there to help, especially my own family, not only someone else's family. So I really made it, you know, a real big thing to really focus on that for diabetic eye disease and diabetes, and getting everything back, your circulation back. So we noticed it worked really well with that. We had really good results with that, and then we had results with glaucoma, cataract. I mean, it just goes down the line with cataracts and everything. And the reason I'm saying all this stuff that it works for is because it's documented, from other people. I'm just saying what other patients are. We're saying their testimony. So yeah.
Brian, you said, you mentioned circulation,
Yes.
Can you tell us a little more
Yeah.
about circulation
So-
problems?
So what it does is the eye drops helps with get your circulation back. So say,
Well, so far it works.
yeah,
All
that's
the
what-
patients that been on it so far, it works. for
they're like,
circulation.
say they're
Everybody's different, but so far, everybody has been saying they got their circulation back and their eyesight.
and they didn't have to go to the doctor to get amputated. Like,
Wait, so you're talking about diabetes
Yes.
and the ability to get the blood flow to.
Yes.
the
to your
area.
legs and to
Yes.
your
Okay,
your body.
so there's all kinds of circulation issues,
Mhm.
you know, diabetic.
Rampopathy.
is one.
That's one
Yeah.
of them.
Others are, you know, the return, the veins will, get heavy and break and,
Mhm.
you know, all that. What does it do to actually strengthening the vessels and?
So what it does is all through the brain. So that's when it goes through the brain, it gives signals to regenerate your body back again, pretty much. It does, and it helps, because what's going on is we're born with this in our body already, with CBD, with the molecules, and even MSM, what's made up in the environment, naturally is made up in our cells. So I'm reintroducing what we lack, like I told you, because we're always being poisoned.
Yeah.
So I'm just reintroducing what we lack already, so it just gives us that supercharge, and that's why people notice that so quick, because we need it, like our body is lacking it from everything that's, everything that's going on with us constantly.
The food we eat, all that.
Mhm.
Yeah. How did you find out about this?
I started young. When I was 16 years old, I saved my aunt's life from cancer. She only had 2 months left. I came up with a formula because she couldn't eat anymore. So I came up with a formula.
From the same plant?
Yeah, and I saved her, and she's with us to this day. It's all in the magazine too. They talk about her. So I started young.